But let's take the phone call, 702-257-5396. Again, that number to call if you want to be a part of the conversation is 257-5396. I believe our first caller is David. David, thanks for calling in. What's on your mind?
Yeah, I mean, I kind of think it's sickening that people are calling out, Herman Cain. This guy was a wonderful American.
Amen.
And it's a gotcha moment for the Democrats. But let's take this into account. What if it was Elijah Cummings?
I would say that, David, let me be clear. Let me answer your question. Let me answer your question. Let me answer your question. Let me be clear as can be. I don't care that Herman Cain was a Republican. But by the way, just for the record, it is many of the Republicans that are the anti-maskers, last I checked, not the Democrats. But with that being said, I don't care. Hold on a second.
John Lewis got it at a protest.
Then guess what? Guess what I'd be
call him out.
David, David,
you know that.
You don't think I would have called out somebody because they had a D next to their name? Are you nuts? What is wrong with you?
John Lewis was marching.
You're damn right I would have. Okay, I'll prove you wrong right now, David. Okay, David, I'll prove you wrong right now. Just be quiet for 20. All right, pod him down. Pod this idiot down. Okay, David, I want you to listen with your moron ears for 20 seconds. I have gone after the Black Lives Matter movement. You couldn't find a more left-wing movement than Black Lives Matter. I have gone after everybody in that movement for not practicing social distancing. Some of those people not wearing masks. I don't give a crap that Herman Cain is a Republican. You know what we should care about? The fact that Herman Cain is dead. And the reason why he is dead is because he didn't wear a mask, David. You want to pick sides of the aisle? This is about life and death. This isn't about Republican and Democrat, you dope. 702-257-5396 is the number to call. Let's go to Ramona. Michelle is saying, oh, my God, what did I get myself into here? Let's go to Ramona. Ramona, you're next on the Vegas Take. What's going on?
Hey, I'm just tuning in, but I actually was online. I think I might have missed some of it. I keep hearing about personal choice, but it's not a personal choice when you can affect other people.
Exactly. Thank you. Some logic here. Thank you.
You're welcome.
Why is that so, Ramona? And listen, all due respect to Michelle, she's entitled to her opinion. But why is it that we hear so many people say, well, it's your right to not wear a mask, when I say, well, your right to not wear a mask could affect me. So it's not just about you, it's about me, right, Ramona?
Exactly. And it's the same thing with the kids going back to school. We even have our president saying, well, kids, they're fine. They won't get sick from it. Or they might get sick, they'll survive. But what about them giving it to other people?
Michelle, respond to that. Go ahead.
Listen, if you were watching the hearings just a little bit earlier today with Dr. Fauci with the Congressional House, all of the experts said the kids need to go back to school and that the detriment to kids, the detriment to their health, their detriment to their well-being is far greater if we don't go back to school. My kids have been in summer camp, summer school all summer, and they are perfectly fine and healthy. We cannot live in fear of somebody getting sick, somebody dying, and just shut everything down and hurt our future generation. It is the worst decision we could ever make.
Then what's the plan by the President of the United States then? If everybody should go back to school and everything's all fine and dandy, what's the plan from the White House?
I'll tell you what the plan should be. It should be about choice. If you allowed each school district to have a choice whether your child is going to go to school in person or go to school online, we would have less numbers in school so we could do the proper social distancing. And remember, our governor just changed the social distancing rules for school from 6 feet to 3 feet because that's what the CDC requires. We could make this work, but it's about personal choice.
I think along with personal choice also goes public safety. So that's something that you need to balance out. But let's see what you guys think. The phone lines are full, so let's go back to the phone lines. 702-257-5396. Let's go to Jake. Jake is next on the Vegas Take. Jake, what's going on?
Hey, well, maybe this is going to be his contribution to getting people to wear a mask. You know, unfortunately, he had to give his life for it. And there's no guarantee that he would or would not have had it with or without the mask.
Mm-hmm.
No, I never said that. Jake,
I know you didn't.
Yeah,
I'm just saying, I've been wearing a mask since early March.
Yep, good for you.
To the point where I was looked upon like I was either a freak or I was rude for doing so. You know, and now it's coming around. But I think, a lot of things, I agree that you should be wearing a mask. I don't quite understand the mentality of I'm not going to let the government tell me what to do, because there are certain things. They don't let you shoot at people. They don't let you do this and that and the other, which, is more directly deadly. But, I mean, if let's say you're not wearing a mask and you sneeze or you cough,
right,
you can infect 100 people. If you take one shot, you might or might not hit somebody.
Exactly.
You know what I'm saying?
No, I know. Listen, I know.
Kind of a stupid analogy.
No, Jake, it's not. Jake, it's not a stupid analogy. And by the way, you're 100% right. And that's my whole argument with this. It's like drunk driving.
The Democrats, my thing about the Democrats is they do like the mask. Am I correct?
I don't think anybody likes the mask. I have to disagree with you, and I don't speak for Democrats. I can only speak for myself. I hate the mask. I hate having to put it on. It's annoying. It's uncomfortable, but I do it because out of respect to other people. 702-257-5396 is the number to call. Why don't we go with Dave? Dave, you are next on the Vegas Take. Dave, what's up?
Hey, guys. You made a wild statement that he deserved to die. I mean, that was shocking. That was shocking.
First of all,
coming out of your mouth.
First of all, Dave,
Dave,
yes. If you are someone in your early 70s, you are old, you have underlying health conditions, you've fought stage 4 cancer, you're tweeting out anti-mask rhetoric, you're going in public with thousands of people like a Donald Trump Tulsa campaign rally, you're not practicing social distancing, you're not wearing a mask. Let me ask you this, whose responsibility does it fall on that he contracted the virus? Who? Tell me.
Okay, let me flip this on you.
No, you're not flipping anything. No, you're not flipping anything. Answer the question. Have you ever heard of John McEnroe? Answer the question. You heard what I just asked you. Now answer. Whose responsibility does it fall on?
You deserve to get shot.
All right. If you're not even going to answer that question, have a nice day, sir. I've had enough of you. 702-257-5396 is the number to call. Let's go to Anthony. Anthony, you're next on the Vegas Take.
Hey, Ryan. You know, after listening to this conversation, what really bothers me is that we just lost another ICU doctor Friday in Texas.
Yep.
For treating COVID-19 patients, right?
Mm-hmm.
He's dead. His job was to treat people.
Right.
I've never heard of one doctor, and I guess your guest can tell me, that died from treating a heart attack patient.
Michelle, respond to that. That's a good. Hold on.
I've never seen one.
Hang on the line, Anthony. Hang on the line, Anthony. I think you brought up a very good point there. Let's let Michelle respond to that. Go ahead, Michelle.
Specifically with a heart attack? No, I doubt a doctor has died from treating specifically a heart attack. But have doctors been around viruses and things that could have hurt them? Have doctors passed away from treating other patients? Yes. Not from a heart attack, but from other patients, absolutely. And let's remember this, too. The top doctor in the land, the U.S. Surgeon General, tweeted earlier, and I quote, "Seriously, people, stop buying masks. They are not effective in preventing general public from catching coronavirus. But if healthcare providers can get them to care for sick patients, it puts them and our communities at risk." There has been misinformation and changing of narrative nonstop since coronavirus hit when it comes to masks.
Well, I think the president has been more inconsistent than anybody. Yes, Dr. Fauci, and there were some people early on that were not pro-mask, but they changed. They were somewhat anti-mask, and then they changed their minds on that. But it was the president of the United States that didn't adapt to it. Anthony, go ahead.
Yes, and also when I go and see patients in the ER, in ICU, or NICU, I have to wear a mask, right? It stops bacteria. It helps patients. That's why we wear it. Every doctor you see, even going into surgery, wears a mask.
Of course.
Anybody say masks don't work, that's kind of absurd. And also I have another issue with your guest. I've seen now three Republican congressmen and voter people go to jail, right, for messing with votes. Republicans, I haven't seen one. If she can give me one Democrat, I would gladly hear it. I haven't seen one. I've seen 3 Republicans go to jail.
No, I hear you, Anthony. You listen, voter fraud. We touched on that topic, Anthony. But to your first comment, you're right. Nobody's ever treated anybody for heart disease and died. And I am so sad that there are so many brilliant doctors and heroes and frontline workers, and some of them sadly have died from this virus only because they've wanted to save the lives of others. Let's get back to the calls at 257-5396. Let's go to Glenn. Glenn, you are next on the Vegas Take. What's going on?
Hey, how you doing? We haven't learned from history, because at the turn of the 20th century, there was a woman called Typhoid Mary. She was asymptomatic, but she carried typhoid. And everywhere she went, and she was a cook, everywhere she went, people would get sick and some would die. She knew this, and she would change her name and go to other places. Nowadays, we have thousands of potential COVID-19 Marys who don't care about other people. They don't care the fact that they're asymptomatic and could spread it. And people, doctors need to talk about this more, the seriousness of being asymptomatic.
Michelle, stay on the line there, Glenn. I think you made some very good points, similar points to what I'm making, that you can affect other people. Michelle, what would you say to what Glenn said? That, listen, if you're asymptomatic, you could be affecting so many other people.
No one is denying the science of that you could be asymptomatic and still spreading the disease. At least I am not denying that. The issue is about the mask mandates, and that's what's really at the core of it, whether it should be mandated or not. I don't think most people sit here and say, masks, they aren't effective. They aren't effective at all. Hey, cloth masks are better than no mask, but are cloth masks the same as surgical masks? Absolutely not. Are there levels and are there grades of masks? 110%. Yes, you can spread something and be asymptomatic, of course.
Well, here's what I'll say. If you have AIDS knowingly and you're having unprotected sex with a woman or a man, there are rules and laws in place. To me, that's murder. I'm not saying that everybody out there not wearing masks knows they have the coronavirus, but certainly it wouldn't shock me if some of them did. If you're knowingly going out there and you're not wearing a mask and you're not in quarantine, don't you think you should go to jail?
No, absolutely not. Remember, in the beginning of this pandemic in early March, the scientists and the experts, they clearly stated that we were going to see 2 to 3 million deaths to coronavirus in America alone by July. And then they said if we social distance, we would see it at 1 to 2 million by July. Here we are in July, and we have seen just now over 150,000 deaths. This is not as deadly as being perceived.
Because we've been practicing social distancing, because we shut the economy down. But I have to go back to what I said earlier. You're telling me, think about this for a second. You're telling me that if I knowingly have the coronavirus, which I don't, but let's just say I did, I knowingly am positive for the virus, and I'm going out there in public knowingly, and I am not wearing a mask, and I am not practicing social distancing, you don't think I'm breaking any laws by doing that? What's the difference between doing that and having AIDS, knowing you have AIDS, and having unprotected sex? It's the exact same thing. You knowingly have a disease.
Because you walking around with AIDS doesn't give anyone else AIDS. You have to have sex with them, and you have to have, hopefully...
Not practicing social distancing, sneezing on somebody, not wearing a mask, can knowingly give somebody the coronavirus. What's the difference?
But if they don't know that they have the coronavirus, you're asking them...
No, but that's what I just said. Knowingly you have the virus.
If you knowingly have the virus, yes, you should self-quarantine. I think
what
pretty
if you
much
don't?
Well, how do you mandate someone self-quarantine?
Well, I'm just asking you. Somebody that knowingly has the virus.
Then you might say that they're a jerk. You might say that they are not a good person.
A jerk is somebody that cuts me off on the street. Not somebody that knowingly has the coronavirus that selfishly can give it to other people that's not wearing a mask.
Well, you could use other words that are not allowed on the radio.
Well, it should be against the law. Okay, so I think you misunderstood. I'm saying if you knowingly have the virus, but here's my problem. We agree on that, right? If you knowingly have the virus, you damn well should be either in quarantine or practicing social distancing, right?
100%.
Okay, I'm glad we agree on that. Now let's take it a step further. There is something, as you know, called asymptomatic. There are many people in this country that do not know they have the virus. So with that being said, shouldn't everybody practice social distancing? Shouldn't everybody wear a mask because we should care about other people?
And aren't we practicing social distancing? Because at the end of the day...
No, not everyone is, because you're saying you should give people a choice and they shouldn't have to wear a mask.
Yes, you should give people a choice, because if you're that worried about catching it and you want to live in fear, then stay in your home. It is your choice. You don't have to go to a restaurant to eat. You don't have to go to Walmart. There are other alternatives.
There are selfish and idiots out. I'm not saying you're doing this, but there are idiots out there that are selfish, that don't care whether they're asymptomatic or not.
And if you're worried about those selfish people, please stay home. Use your Amazon Instacart. Well, I think it's unfair that you prevent everyone else from going to church, but everybody else can protest. I think it's unfair that you prevent people going to school so that my kids could be hindered, but just because some teacher over here is scared.
I agree with you that we have a lot of inconsistencies in this country. I don't agree with any protesters that are not social distancing, that are not wearing masks, just as I don't agree with 100 or 200 people packed into a church not practicing social distancing either. I think they are both wrong. I think we are facing a pandemic, and they both should not be allowed at this time. Do we have enough time for one more caller? Why don't we go to Joe? Joe, I got about a couple minutes for you, my man. What's up, Joe?
How you doing, Brian?
What's up, Joe?
I wanted to. Yesterday, I called in and I called you a liberal, and I'm sorry I insulted you, but technically I called you a classical liberal. So, just to clarify that, but I wanted to speak about. I can understand how you would allow somebody to compare shooting people to not wearing masks in light, especially.
Where did I compare shooting people to not wearing masks? I have no idea what you're talking about.
About 3 callers ago, you had a gentleman make the comparison of shooting at people to not wearing a mask.
Again, I have no idea what you're talking about. I did not make the comparison to shooting people.
No,
you are wrong.
Made the comparison.
Okay, I don't speak.
I'm not saying you
okay,
did,
a lot of
but
callers.
You said that was a good call.
A lot of callers.
And you agreed with him.
I have no idea what you're talking about. I really have no idea. I've never compared shooting people to the coronavirus. I have no idea what you're talking about. I don't speak for all callers that call into this show. Sadly, we get some idiots like you that call in that misrepresent the facts. I have no idea what you're talking about. Let's go to Steve. Steve, you're next on the Vegas Take. Steve, what's going on?
Hey, Brian, and hello to your guests, too.
Thank you.
Hi.
What I'd like to say, if you can give me just 1 minute,
Sure.
I think it'll be some good information.
Sure.
1917, and Brian, I know you're a good fact checker, and I love the fact that you say factually accurate all the time. That means you're a good fact checker. 1917, the population of the Earth was 1 billion people. 5% of the entire planet died, okay? 50 million people in about 2 years. It has been 6 months. Everybody said, this is the worst thing ever. This is the worst thing ever. 6 months is 1/4 of 2 years. We got about 1 million people dead. So the Spanish flu, percentage-wise and population-wise, killed 100 times or more what this did. So how can this be worse than any flu ever when it killed 50 million people? Even though I know the medical technology and medical knowledge and medicines back then weren't as good.
I'll respond to that.
You also had a healthier race of people who didn't eat junk food, sit on the couch all day, and inhale toxic air.
Understood, Steve.
So how
now,
can this be worse than the flu?
Okay, so I'm not comparing coronavirus to the Spanish flu. There are people out there that like to compare the coronavirus to a cold or just the general flu in general. Now, I will give you a statistic. For example, last year, around 75,000 people died of the flu. That was over a 12-month period. We've had over 150,000 people die in a little over a 5-month period. At minimum, and by the way, this is at minimum, Steve, this is 2 times more lethal than just the generic flu. That is at minimum, and I believe when it is all said and done, sadly, it'll be higher than that. I don't like to compare this to anything else. You know why? Because we've never seen anything like this before. It's a global pandemic.
It's a virus, I admit. But I will say this, Brian. I know you're a big advocate of masks, and I respect that. You know, win, lose, or draw. And here's the thing, and your guess may be less I get in favor of masks, which is okay, too.
Yep.
Here's what I say. It is a dangerous thing, and we got to be careful. But I believe there's a lot of overreaction.
Well, there might be. Listen, Steve, there might be, and I appreciate your phone call, but even if there is overreaction, I don't think it's an overreaction to ask people to social distance and wear masks. I don't think that's an overreaction. But anyway, Michelle, we're going to take this on the other side of the break, and we'll take some more phone calls, obviously, at 702-257-5396. Again, that number to call, 257-5396. I don't think it's wrong for somebody to criticize someone even if they are dead. Did I want Herman Cain to die? Of course not. Do I feel for his family and friends? Of course I do. But as I said to one of the callers earlier, Michelle, and they wouldn't answer me, whose responsibility is it when somebody is in their early to mid-70s who has fought through stage 4 cancer, who just a few weeks ago was putting out anti-mask rhetoric, hanging out with thousands of people at a Trump rally in Tulsa, not wearing a mask, and now he's dead? Whose fault is that? Whose responsibility is that? Listen, you could wear a mask, you could stay in quarantine, you could do all the right things. You still can get the virus. In no way, shape, or form am I saying that. But based on his behavior, whose fault is it? So we're taking your calls at 702-257-5396 is the number to call if you want to be a part of the conversation. So we'll take all your calls when we come back, and we're also going to get to a few other subjects. If you're wondering where JD is, he is on vacation. But we have Michelle Mortensen in studio. You might recognize that name. She is a former reporter for Channel 8, a good one at that, and a former political candidate as well. As you can see, we agree on some things. I thought we might disagree on a few things, which is good, by the way. I prefer that. And as I've said before, she's much more pleasant to look at than J.D. Sharp. Don't get me wrong. J.D. Sharp is very manly-esque, and he's got a full head of hair, unlike me. But we're glad Michelle is here. I'm Brian Shapiro. We'll take a quick break.